And good early morning, everyone. Nick Weig here with you at the Alert Center. We are coming on our streaming channel as well as on social media this morning because a plane carrying Americans exposed to the Hantavirus aboard that Dutch cruise ship is minutes away from landing at Eppley Airfield here in Omaha. Let's take you out live now to the airport where our crews are standing by. That plane now making its way towards Omaha is scheduled to land in just about 10 minutes from now. Since that plane took off, we have learned that of the 17 people aboard, one has now tested positive for the hantavirus, and another has begun exhibiting symptoms but has not tested positive. So this changes things a little bit. The plan was to send all of them to the National Quarantine Unit here in Omaha, but now at least we know that the one that has tested positive will be going to the biomedical lab here in Omaha for observation and potential treatment. Hantavirus, of course, a very, very deadly disease that was spreading through that cruise ship for several days before finally reaching land at a place that would accept them at the Canary Islands just about 24 hours ago. So again, we have a crew standing by at the airport right now. We have another standing by at the hospital where these Americans will be taken. And we will hopefully bring you a live coverage when that plane comes in here in just a few minutes. In the meantime, the operations to evacuate passengers from the hantavirus hit Hondius vessel concluded on the Canary Islands yesterday. 17 American passengers have been en route to the special quarantine unit here in Omaha for screening and assessment. And again, we've since learned one has now tested positive and at least one other is symptomatic. One evacuee also began showing symptoms during their flight home to another country just yesterday. Melissa Bell has the latest now from the Canary Islands.
It was at sunset that the operations this Sunday to evacuate the MV Hondius came to an end. The very last passengers to be disembarked, these 17 Americans who, like the others, had been stuck on the ship for more than 5 weeks. They were taken to shore, as had the French, the Dutch, all the other nationalities over the course of the day, by small boats and in batches of 5, brought ashore, taken through a tent, put on a bus, and then taken to the waiting plane ready to carry them back to Omaha, Nebraska. From there, they go on to the special quarantine unit where it is, we understand from CDC officials, they will be screened, assessed, and then it is hoped, for the most part, allowed to carry out their isolation period back home. Different protocols for different countries. We have had the news that amongst the French passengers that were evacuated earlier in the day, one of them had begun showing symptoms on the flight home. Special procedures now being put in place by French authorities around that passenger. But the end of a successful day of operations here at the small port of Grenadier. They will continue on Monday. The very last passengers to be taken off the ship will be the Australians, and then we understand that the ship itself will head back to Rotterdam for a full disinfection with some 30 crew members still on board. Melissa Bell, CNN, Tenerife.
Now back here live to Omaha, where our crew is standing by at Eppley Airfield, where the ship carrying 17 Americans from the hantavirus ship is scheduled to land here in just about 6 minutes or so. Right now, just checking the latest information, that plane scheduled to land at 2:21 Central Time here, so in about 6 minutes rather, it should be landing at the Eppley Airfield, and we are standing by for that. Once once the plane lands, they will be loaded up onto what I presume are those buses you see there, those passenger vans, I guess, and they will be heading to UNMC. Most will be going to the quarantine unit there, but since departing from the Canary Islands, one person on the American plane has tested positive for hantavirus. Another has been exhibiting symptoms, and so at least the one that has tested positive will now be heading towards the Biocontainment Center at UNMC, and the rest will be going to the quarantine unit. As you heard from Melissa Bell there, they're not expected to stay in Omaha if all they are doing is quarantine. Eventually, they'll be allowed to return home and self-quarantine for upwards of more more than 40 days, as the incubation period for the hantavirus can be anywhere from 1 to 8 weeks, making it very difficult to detect before symptoms appear and conduct that contact tracing. Fortunately, that is underway, and so far the only confirmed cases have been aboard the vessel that took a cruise through to Antarctica before returning and eventually finding port in the Canary Islands. Now, operations to the acting director of the CDC, the Centers for Disease Control and Prevention, is pushing back against criticism of the agency's response to the hantavirus outbreak. This is after that deadly but contained outbreak spread through that cruise ship and has caused a number of reported cases, at least 6 so far, if not more, and at least 3 people among those cases have died. Now, health agencies still say that the broader risk to the public remains low. And yesterday, CDC's acting director said there is no reason that the public should panic.
We're going to interview them and assess them for risk. Risk meaning, in this case, risk doesn't mean the risk of dying from the disease or anything. The risk is a high risk if they've been in close contact with somebody who was symptomatic. If they weren't in close contact with someone who was symptomatic, then we're going to deem them low risk. If they were in close contact, we're going to deem them medium or high risk. At that point, we will offer them alternatives.
That the acting director of the CDC on CNN yesterday. We again are still standing by for the arrival of the plane carrying the 17 Americans that were on board the Dutch cruise vessel that had an outbreak of hantavirus. We have learned one of those individuals has since tested positive for hantavirus. At least one other is now symptomatic, but no confirmation that they have contracted the virus. Now, hantavirus is extremely dangerous. In fact, the mortality rate here in the U.S. is around 35%. And this is a virus that has no known treatment and no known cure. So basically, all medical officials can do is provide care for the symptoms, as there is no direct treatment for the hantavirus. Now, this landing here in Omaha is taking place just about 24 hours after passengers on board that vessel arrived in the Canary Islands, which finally agreed to allow them to deboard there, and they were greeted by health officials that took them off the ship and ferried them to buses that took them to the airport, and those on board were taken to their various countries of origin that were all making preparations to house the individuals as they began their quarantine period. And so this was the view from yesterday as health crews were approaching the cruise vessel and preparing all of those on board. More than 150, I believe, were on board to continue their quarantining in their home countries. Let's go back out live now to Eppley Airfield here in Omaha, where we are standing by for the Americans on board that ship to make their landing. Right now, the last information we have is that the plane is set to land here in just a couple of minutes. So that is what we're standing by for right now. We're monitoring flight tracking data, and right now it is approaching the airport and is scheduled to land here in just a couple of minutes. Once that happens, you may see there in the distance there is a ladder truck prepared to bring the passengers off the plane, and there appear to be some passenger vans there that they will then board and be taken to downtown Omaha to the medical facilities here. Most will be going to the National Quarantine Unit here in Omaha, but now that one is tested positive, we know that at least that individual will be going to the Biocontainment Unit for supportive care. Now, we're being told by the CDC that after some evaluation and some monitoring here in Omaha, those that are not exhibiting symptoms will be allowed to return home and self-quarantine. That quarantine period is expected to last a little over 40 days. Hantavirus, as we've been talking about, is a very deadly disease. There is no treatment, but it's also a disease that, unlike other respiratory ailments, the symptoms may not present themselves for several weeks, upwards to 2 months after exposure. This is different from most respiratory diseases. Obviously, with the flu or COVID, that incubation period between exposure and symptoms is usually just a couple of days. Obviously, a much more difficult process to track this, but officials do stress that this is not as easy to contract as other respiratory ailments. It is not that contagious airborne, but it is contagious via close contact. This particular strain of hantavirus, known as the Aspen variant, is known to be particularly deadly, and in this case, we have seen cases of human-to-human transmission, which is exceedingly rare. Most individuals who contract hantavirus, especially here in the U.S., contract it from being exposed to contaminated rats or other rodents. So the very few cases that the United States sees is often in the desert Southwest, possibly in other more desert areas, including Texas, New Mexico, Arizona, but very, very uncommon disease, and so there has been very little known treatment for it. And again, here in the United States, at least, the mortality rate is around 35%, a very, very high mortality rate for a virus. And so we are, obviously, that is why all of the precautions, all of the concern, but health officials again stressing this is not as contagious as something like the flu or COVID, but obviously containment is critical to prevent further mutation that could make it something that could later become more contagious. Obviously, that's something that we saw with varying strains of COVID during the pandemic, and that's something that they would like to avoid and have been very successful in recent decades in preventing major hantavirus outbreaks by simple containment and quarantine. And that is what we expect to happen here. Just giving you an update on the flight that we expected to have landed by now. We're now, looks like they may be coming around the airport a bit here, according to flight tracking data, and right now it's scheduled to land in about 3 minutes, but that would be why the delay. But by all accounts, the plane that we've been tracking since yesterday, after leaving the Canary Islands, is now just moments away from making a landing here in Omaha. Again, there are 17 Americans on board the plane. These were 17 Americans that were on board the Dutch cruise vessel. It was taking a cruise to Antarctica, and on the way back, after several cruise members rather deboarded, a couple, older couple that were on board became ill. Both eventually passed away, and it was not determined until later that they had died from the hantavirus. At that point, people were told to quarantine on board the ship. At least 4 other cases among people on board that ship have been confirmed. But again, we now are getting word that 1 American on board the plane has now tested positive, and there could be another potential positive among another cruise member as they were returning to their home country earlier yesterday. So there could be anywhere from 6 to 8 confirmed cases. At least 3 people among those have since died. 1 other person on board the plane about to land here in Omaha has begun exhibiting symptoms that could suggest hantavirus, but they have not tested positive as of yet. So it's not exactly clear exactly what will become of them, if they will go ahead and head into quarantine, or if they will be transferred to the Biocontainment Unit here in Omaha, which is where the 1 American that has tested positive will be headed now. Again, this is a live picture from Eppley Airfield here in Omaha, where we are standing by for the flight from the Canary Islands, which departed the CDC in Atlanta yesterday to pick up the Americans on board the Dutch cruise vessel, which experienced the hantavirus outbreak, is now scheduled to land here with the 17 Americans on board in just a few minutes. It appears they are circling around the airport right now. My presumption would be is they're lining up for a specific runway here where emergency crews are all staged. You see those passenger vans in the live picture, and presumably those are the vehicles they will be getting on board once they get off the plane to be taken to the national quarantine unit, and then at least the one that has tested positive will be headed to the biocontainment unit here in Omaha. We do have a crew on standby at the hospital right now. We also have a crew on the scene at the airport where the plane should be landing here in just about 2 minutes is what we're being told right now, as it is making its final approach to the airfield here in Omaha. And you can see our crew there spinning the camera around, possibly maybe getting an image of the plane as it is coming in. There you see it. There is the plane making its final approach. Again, this is the plane carrying 17 Americans that were on board the Dutch cruise vessel that has experienced this Hantavirus outbreak. They are now on final approach here to Omaha. Again, they will be landing. One has since tested positive. They will be taken to the National Containment Unit here in Omaha. Another has become symptomatic rather, but has not tested positive. So again, we are standing by for that. We're not sure what will happen to the symptomatic individual. The other 15 on board that have not tested positive, have not exhibited symptoms, will be going to the National Quarantine Unit here in Omaha. And the individual that has tested positive, we know, will be headed to the biocontainment unit here in Omaha. The quarantine unit, according to Nebraska Medicine, is the only federally funded quarantine unit in the U.S. It is a place to safely house and monitor those who have been exposed to high-consequence infectious disease. These units, the Biocontainment Unit and the Quarantine Unit, have both been used in the past during the early days of the COVID-19 pandemic, and also in 2014 when individuals were brought to the United States for treatment and isolation from an Ebola outbreak. In both cases, especially in the Ebola outbreak, containment was successful. Unfortunately, COVID was a much more spreadable and infectious disease, and health officials were unsuccessful around the world in stopping the spread of COVID. Now, of course, health officials are stressing in this case, this is not COVID, this is not the flu. It is a very dangerous virus, but is not as easily transmissible. It is not transmissible in public places. It requires close contact, and that is why the concern there, as you see, the plane has just landed. That is why the primary concern here is all of these individuals were in close contact aboard a cruise ship, and like many less serious ailments, they can spread rather quickly aboard a cruise ship. So it appears the plane has landed. It will be taxiing over to the area you see here, where you see the passenger vans have been set up, and we should see the plane taxi over to this area momentarily. But the plane has landed here in Omaha with the 17 Americans that were on board that Dutch cruise vessel. Again, we are awaiting visual of the plane, presumably taxiing over to this area after just landing a short time ago. There you see what we believe is the ladders that will allow them to get off the plane, and then there are passenger vans there where we expect them to get on board. Obviously, staying away from the terminal. Quite an unusual flight This plane taking off from the CDC yesterday for the Canary Islands, where the ship, after weeks at sea, was finally allowed to dock, and health officials were allowed to get everybody off board with the exception of the ship's crew. About 30 people remain on board the ship that will be monitored as obviously a significant disinfecting cleaning goes on that ship. But everyone not working on that ship has now been, one way or the other, returned to their countries of origin, including these 17 Americans that now have arrived here in Omaha. Now, health officials here in Omaha say that this is something that they have done in the past and they are prepared to do again no matter what happens here. Dr. Della Davies, with the interim chancellor at UNMC, says that there are experts that have been doing this for years. They have an interdisciplinary team that's very competent, and they have the ingredients to ensure that they can care for those exposed to hantavirus while keeping the public safe, which they say is their #1 priority. Again, a dozen countries were accepting their citizens over the last 24 hours. Some of the first that got off board the ship arrived home in Spain late yesterday. In every case, each individual country is handling containment and quarantine, and Omaha obviously has some of the finest facilities for such an act here in the United States, and so that is why the Americans have been brought here to Nebraska to at least begin their quarantine or potentially receive treatment now that one has tested positive. Omaha Mayor John Ewing also releasing a statement late last night saying that the city leadership here in Omaha has been briefed on the situation. This does include the mayor's chief of staff, council leaders, as well as first responders here in Omaha. The mayor saying, quote, "We are confident in the quality of care that these individuals will receive, along with the protocols to keep healthcare workers safe." To our knowledge, there was no accidental exposure at times when these units were used during the COVID and Ebola outbreaks of years past. And obviously, these are highly trained, highly skilled teams here in Omaha, and that is why these individuals are being brought here for quarantine and care. Now, those that don't exhibit any symptoms, those that do not test positive and don't exhibit any symptoms, ultimately will be allowed to continue their quarantine period, which could last over 40 days after arriving here in Omaha. They will be allowed to continue that quarantine on their own at home. Now, we don't know the details of how they will be transported from Omaha to wherever they come from here in the United States, but that is the plan as of now. But they're going to begin that quarantine period here in Omaha, obviously undergoing some monitoring and testing while they are here. Again, as many as 17 Americans on board this plane that come from that Dutch cruise vessel. One, since departing that ship, has now tested positive for hantavirus, and another has begun exhibiting symptoms, although they do not appear to have tested positive as of yet. So for the individual that has tested positive, they will not be going into quarantine. They will be going to the Biocontainment Unit here in Omaha for intensive monitoring and care. There is no known treatment. There is no known cure for the hantavirus. It is a particularly deadly disease. The mortality rate here in the United States is somewhere around 35%, and so that is why there is the abundance of caution here. Although a very deadly disease, it is not as easily transmissible as other viruses like COVID, like the flu. It is an airborne disease, however, it requires close contact. Unlike the flu or COVID, which does not require close contact, it merely requires two people to be in the same space. And in this case, it needs to be a much more intimate contact. That's why we saw the first cases in an older married couple that unfortunately did pass away. And among 100, I believe more than 150 people that were on board that cruise vessel so far, anywhere from 6 to 8 individuals have tested positive. And the hope is that the majority of people on board that ship will not test positive, and that this can be contained now that quarantining procedures have been put in place. Again, we continue to stand by as you're looking at a live picture from Eppley Airfield here in Omaha, where a plane carrying 17 Americans that were on board a Dutch cruise vessel that experienced a Hantavirus outbreak has just landed. And they will now soon, we believe, get on board those passenger vans and be taken to the quarantine and biomedical units here in Omaha for ongoing monitoring and care. Now, those units are world-renowned. They are capable of dealing with situations like this, and they will be in the position of caring for these individuals should more become ill, and if they don't, they will begin their quarantining process here before they move on to self-quarantine at home. As we're awaiting the arrival of the plane that has just landed, we want to take you out live now to UNMC, where our other crew is standing by right now. There you see the health center where the 17 individuals on board the plane will be taken once they do get off that plane here in just a few moments. Back out live now to Eppley Airfield, where we are getting our first look at the plane after it made its landing. There you see it taxiing over to the area where our cameras have been allowed to view what is happening. This plane took off from Atlanta, the home of the Centers for Disease Control and Prevention, yesterday, arrived in the Canary Islands late last night, local time, and is now arriving here in Omaha just after 2:30 this morning here on Monday. The 17 individuals on board, 15 have not shown any symptoms, have not tested positive. One has tested positive now since departing the ship, and one other is now exhibiting symptoms that could indicate that they have contracted hantavirus, but have, to our knowledge, not tested positive for that disease. So we expect to see the plane here make a turn towards the vehicles that we've been showing you here since coming on the air, and the individuals on board will be likely surrounded by health officials in protective gear and be allowed to board those passenger vans that will take them to downtown Omaha to UNMC, either to the quarantine unit or the biomedical center here for treatment and observation. These individuals were on that Dutch cruise ship, which took a trip down to Antarctica and back, but unfortunately did make a stop before the hantavirus was detected, and so there is still contact tracing going on to ensure that the infection doesn't spread beyond those that were on board the ship. To date, it has not, but that contact tracing continues to go on with individuals that then departed the ship and then boarded planes and may have been carrying the disease. But right now, health officials remain relatively confident that they have all of the cases that they know of contained, and that they can prevent a larger outbreak from beginning somewhere around the world. Again, hantavirus is not as contagious as diseases like COVID or the flu, but it is particularly dangerous. There is no treatment for it, there is no cure, and here in the United States, with the limited cases that are seen every year, the average mortality rate, the number of people who die that contract the disease, is around 35%. Now, to put that into perspective, people who contract flu or COVID, at least now, it's well below 1%. And those are diseases that still kill tens of thousands of Americans every year because they're so contagious. Fortunately, hantavirus is not as contagious. It can be transmitted through the air, but it requires much closer, prolonged contact than the flu or COVID, and that is why health officials still remain confident, even though this is a particularly dangerous variant known as the Aspen variant. Health officials remain confident that they can stay ahead of this outbreak and prevent it from becoming a public outbreak or, worst case scenario, a pandemic. But again, all measures have been taken since the first cases were detected aboard that vessel several days ago. And so far, the expectation is that they can get this contained. Now, the first two cases were a couple that boarded the plane after they had conducted bird watching in South America, and the belief is they may have contracted the hantavirus while they were on or near a landfill where they were observing birds in that area. Obviously, landfills are very attractive to rats and other rodents, and those are the types of animals that carry the virus. It is extremely rare for the virus to be transmitted from human to human, but this particular variant appears capable of doing that, and there has unfortunately been human-to-human transmission aboard that vessel. The two individuals who originally contracted the hantavirus, or are believed to be the original patients, have both unfortunately passed away. One other individual who contracted it aboard the vessel has also died, and as many as 3 to 5 others have now tested positive, including during this flight from the Canary Islands to here in Omaha. At least one American has now tested positive for hantavirus, and another is now exhibiting symptoms and is being closely monitored. Some 15 others Americans that were on board that ship have not tested positive. They are not exhibiting any symptoms, but as authorities say, the hantavirus does carry a very long incubation period, and what that means is it can be anywhere from 1 to 8 weeks from the point that someone is exposed until they begin exhibiting symptoms. And so it's a very long period of time that somebody is going to have to be in quarantine to either prevent them from transmitting it to someone else or to ensure that they themselves don't have it. And so what we're hearing from health officials is that this quarantine is going to last more than 40 days from this point. And for those that don't test positive, for those that don't exhibit symptoms at all, they will likely be spending a few days in Omaha and then ultimately sent home to self-quarantine for the remainder of that period. But for those that exhibit symptoms, it's not clear what's going to happen to the one individual that is now symptomatic. And for the one that is tested positive, they will not be going into quarantine. They will be going to the biomedical unit here in Omaha for close observation and care. There you see crews making their way around the plane as they prepare to drive a set of stairs over so that the individuals on board can get off the plane, and there are some passenger vans there at the scene that we are keeping an eye out for. And I believe we do have, I'm going to go ahead and take a different shot that we have here. There you see the what appears to be the ladder or the stairs there approaching the plane. Obviously, a lot of first responders on the scene, but not a lot of people out and about, as obviously contact is going to be extremely limited here. I presume we'll see some health officials helping these people off the plane, likely in what we know is from the COVID era, the PPE, the personal protective equipment that will prevent them from becoming accidentally exposed to the hantavirus. If any of these individuals, we do know that one obviously has tested positive. We don't know what their condition is at this time, just that they have tested positive, and that one other individual has not tested positive but has begun exhibiting symptoms indicating that they may have contracted the hantavirus. There you see crews making their way around the plane. Obviously, maintenance crews still have to conduct their regular checks. The individuals just working around the plane shouldn't be at any risk of exposure to the hantavirus. Again, this is not as contagious as the flu. It is not as contagious as COVID-19. It does require close contact, more prolonged contact than simply just passing by an individual. And of course, those are some of the variables that leave health officials confident at this point that they can contain this outbreak that began after 2 infected individuals boarded that cruise ship last month. There you see the plane. We're going to go ahead and zoom in here where we've seen a ladder truck or stair truck, I guess you could say, approach the plane. We do expect to see individuals begin getting off the plane here in just a little while. Ultimately, they will be taken to UNMC. Most will go to the National Containment Unit there. The rest, however, will be headed for at least the one individual that has tested positive will be making their way to the biomedical unit there for observation. Here now is a live picture from the medical center, where we have another crew on the scene standing by for the arrival of individuals there. After they get off the plane at Eppley Airfield, we will have more from them here in just a moment. Of course, I do want to remind everybody that we do have full coverage on our website, firstalert6.com. And we will have live reports from every angle of this story coming up on First Alert 6 beginning at 4:30 this morning. So if you are up for the day, be sure to tune in, as we will have full team coverage of this morning's breaking news coming up on First Alert 6 beginning at 4:30. Back now to Eppley Airfield. There you see the crews continuing their work to get the individuals off that plane. Of course, that will be a bit of a process. They also need to get the vehicles standing by to get in position for the individuals on board the plane to then get on board. Of course, we expect 17 individuals from the Dutch cruise ship to come off the plane. We don't know if presumably some of the health officials on board may also be going with them to the facility here in Omaha. As you see, first responders getting into position and getting prepared for any eventualities. Again, we don't know the condition of the individual that has tested positive. We're not sure if they're able to leave the plane under their own power or if there are other accommodations being made to help them get off the plane and into the Biocontainment Unit here in Omaha. To recap, for those of you who might just be joining us, you're looking at a live picture from here in Omaha where a plane carrying 17 Americans that were on board a ship that experienced a hantavirus outbreak have now landed here in Omaha. One has, in the last 24 hours, tested positive. Another is exhibiting symptoms of hantavirus. And the others have not tested positive, have not shown any symptoms. All of those asymptomatic individuals, and presumably that the one exhibiting symptoms will be placed under quarantine at the National Quarantine Center here in Omaha. The individual that has tested positive now will be on their way to the Biomedical Containment Unit. Now, these are world-class facilities here in Omaha that have been utilized during the Ebola outbreak in 2014, the early days of the COVID pandemic in 2020, and now are being utilized for what is a very, very dangerous disease, but is not as easily transmissible. Unfortunately, though, for those on the cruise ship, at least several people have now tested positive. The total number of cases ranges from anywhere between 6 and 8 now, and of those, 3 have passed away. Here in the United States, there are a very low number of hantavirus cases reported every year. These cases involve individuals who have come in contact with infected rodents, most often in the desert Southwest. And among those, on average, the United States reports about 35% of people that contract the hantavirus, unfortunately, do pass away. And I believe we are now seeing those passenger vans now being moved into position here. As you're taking a look at another one of the live pictures we have from the airfield this morning, several passenger vans now moving into position that will take those individuals to their respective areas. It does appear that there is an ambulance in that caravan. Unclear if that is the vehicle that will be taking the individual that is tested positive, or if that will also carry the individual that has begun exhibiting symptoms. But we do see one ambulance in that line of vehicles, that convoy that will be escorted to the Nebraska Medical Center for treatment, containment, and quarantine of these individuals. Now, for those that do not test positive for hantavirus, those that do not exhibit symptoms, eventually they will be allowed to go home and self-quarantine. We don't know the exact details of how that will take place, but they are, as far as we have been told, they are not expected to be carrying out their entire quarantine period here in Omaha. That period is expected to last for more than 40 days. Unlike the flu or COVID, the incubation period, the period between exposure and showing symptoms of the disease, is extremely long. It can be anywhere from 1 to 8 weeks, as opposed to the flu or COVID, which can take just a couple of days. So this is obviously a much more significant period of time that, unfortunately, people that were exposed to the hantavirus will have to sit and wait and wonder if they are in fact going to come down with this disease that, again, carries a very high mortality rate, 35% here in the United States, higher in other parts of the world, because there is no known treatment and there is no known cure. So we are, looks like the vans now are getting into position, as well as the ambulance that is also lining up there. Again, we don't know exactly what we're going to see here. Obviously, the main concern is with the individual that has tested positive, whether or not they are able to get off of the plane on their own power. But obviously, for those on board, whether they have begun exhibiting symptoms or not, a terribly frightening experience. As you spend days not knowing when you're going to be able to get off the ship, because it took several days to find a place that they were going to be allowed to dock. And now they, were supposed to be home from an enjoyable trip by now, and now they have landed in Omaha to go under medical quarantine. And now expect to wait weeks to find out if they do come down with a disease that is quite possibly fatal. So it appears the stairs there that you see, the stair truck, is on the rear portion of the plane, presumably where everybody will be deboarding. We see at least 2 or 3 passenger vans there. Also an ambulance is on the scene. Unclear if that is for the individual that has tested positive. We have no indication as to if there's a particular order in which they will be getting off the plane. It's also possible that the individual that is tested positive may actually be taken off the plane from another portion of the plane, as they have likely already been quarantined away from the other individuals on board. Again, we're standing by for the Americans who are on board that ship to step off the plane and step onto those passenger vans. We're also monitoring an ambulance that is on the scene, presumably to take away the individual that has tested positive. It appears that ambulance, if we show you a different angle here, that ambulance is at another portion of the plane, and it appears that there's a stair truck now at the front portion of the plane. Presumably that is where at least the individual that has tested positive will be removed and then taken on board that ambulance, whereas the individuals that have not tested positive will be getting off the plane in the rear section where 3 passenger vans are ready to take them to Nebraska Medical Center. Obviously, for the individual that has tested positive and potentially for the individual that has become symptomatic, they have likely been isolated away from the rest of the group on board that plane. We haven't been given any indication on their conditions, just that one individual has now tested positive and that one other has now begun to exhibit symptoms indicating that they may have contracted the hantavirus. So we're monitoring 2 areas of this plane. There you see on your screen what you can barely make out there towards the center there, that one red tail light. That is an ambulance, and then it appears a stair truck that is getting ready to at least get one individual off the plane that is tested positive. And then as we take a look at another one of our live pictures from the airport, here you see another stair truck with 3 passenger vans standing by. Presumably that will be taking the individuals that have not exhibited symptoms or tested positive off the plane. Again, the reason for these individuals that were on board the ship coming to Omaha is not unusual. Omaha is home to one of the best quarantine and biomedical units in the country. It has been utilized during the Ebola outbreak in 2014, as well as the COVID pandemic in 2020, the early days of that pandemic, in an effort to isolate individuals that had tested positive. There you see the 2 areas that we are monitoring right now. A pair of stair trucks now on the scene. One at the front end, or the front half of the plane, one at the rear half. It appears the one on the rear half is where the asymptomatic people, those not showing any symptoms or signs of hantavirus, will get off the plane and board passenger vans. And then on the front half of the plane, we see an ambulance standing by to take at least one person off the plane that has tested positive for the hantavirus. Another individual on board has begun exhibiting symptoms, and so it's unclear which way they will be getting off the plane, but obviously very significant precautions being taken. Obviously, they do not want to see anybody else exposed to this virus. They want to ensure that these 17 Americans that were exposed and at least one that has tested positive, that is the end of this for the United States. For the others on board the cruise vessel, some more than 150, most have now been returned to their home countries to be monitored and quarantined. Roughly 30 people remain on board the ship. Those are our crew and workers on board the ship. They will remain there to quarantine during their decontainment process to ensure that the ship is clean. and they will continue to undergo quarantine and monitoring as well. Obviously, this is not going to be a quick deboarding, as plenty of precautions are being taken here. Again, the last word that we received from the CDC is that passengers will not technically be placed under quarantine once they arrive at the UNMC Nebraska Medicine campus. They'll be monitored and assessed for a shorter stay, obviously still isolated from the rest of the community at the hospital, and then they will be sent home for self-monitoring. That period will last a total of 42 days, as the incubation period for hantavirus is quite long, especially compared to diseases like COVID or the flu. One individual has tested positive while on board the plane. That individual, at last report, did not have symptoms, but will go to the Nebraska Biocontainment Unit, where they will be treated if needed. Really, the only treatment for the hantavirus is the treatment of the symptoms. There is no actual treatment for the virus, nor is there any cure. But obviously, this scare will likely encourage continued research into treatments, potential vaccines for the potential of one day something like the hantavirus or another virus mutating into something that is more contagious. That is unfortunately what happens with these viruses, is that is how they survive, as they mutate and they make it easier for themselves to spread. But fortunately in this case, although this is an especially dangerous strain of the hantavirus known as the Aspen variant, with a mortality rate here in the U.S. of roughly 35% in the limited cases seen each year. What makes this more concerning is that this is one of those rare events where it wasn't just individuals who contracted it directly from a rodent. There has been evidence that there was human-to-human transmission of the hantavirus aboard this cruise vessel, which was carrying a little over 150 people at last report. As we zoom out here, you see the plane that has landed here in Omaha. There are two stair trucks now on the scene. One at the front of the plane is parked next to an ambulance, and another at the rear of the plane is parked next to three passenger vans, which we presume most of the individuals aboard the vessel will be getting on those vans here shortly. There you see those passenger vans on the rear side of the plane as our crew there zooms in on that area. And then as we take a look at the front side of the plane there, from our other angle, you can see the ambulance there behind the plane, kind of ducked behind it on the left-hand side. So two areas where people are expected to be exiting the plane here at any moment now. The plane had landed about 40 minutes ago, a little less than 40 minutes ago. So obviously they're taking their time, likely explaining what's going to happen to the individuals on board. And we will continue to see as this convoy will eventually make its way to the UNMC campus. And most of these individuals will head to the quarantine area, although the CDC says it won't be an official quarantine, because if they're not exhibiting symptoms, presumably they are either not infected or not able to spread the disease. But ultimately, those that don't exhibit any symptoms, don't test positive, they will be sent home to self-quarantine for roughly 42 days. Those that are symptomatic, those that are testing positive will likely remain either in quarantine or in the Biocontainment Unit here in Omaha. Again, we have multiple crews on the scene right now as we continue to stand by for the individuals to deboard. We also have a crew at the UNMC Medical Campus standing by for the motorcade to make its way there once all of the individuals are taken off the plane. This has been a long and unexpected journey for the 17 Americans that were aboard that Dutch cruise vessel, which was finally allowed to port at the Canary Islands, where they were individuals were taken off and transported to various planes and sent to their countries of origin. Of those more than 150 individuals, 17 from the United States have now arrived here in Omaha. Others have been sent to their various countries. More than a dozen of countries have accepted them, I believe, and then about 30 people who were working on board that vessel, I believe, last report, remain on board the ship and will continue their quarantine there while decontamination of that vessel gets underway by health officials in the Canary Islands. This plane carrying the 17 Americans took off yesterday from Atlanta, where the Centers for Disease Control and Prevention is located. It picked up the Americans in the Canary Islands and then has now arrived here in Omaha, preparing to transport them to the quarantine and biocontainment units here at UNMC. There you see, as we've been showing you, there is an ambulance at the front of the plane where a stair truck has been set up. Not seeing a lot of activity there quite yet. On the rear side of the plane, we also have another stair truck. This is where the passenger vans have been parked. This is where we expect to see most of the cruise passengers get off the plane. Those that have not tested positive, had not exhibited any symptoms, we will likely see them board these passenger vans here shortly. Okay, it looks like, let's go back to the front of the plane now, as we've seen some lights being turned on, some individuals mulling around there. Can't quite make out, but at least one of them, yes, there is at least one person there wearing full body PPE or personal protective equipment next to the ambulance. They have a head protector on, and then that kind of white plastic looking material that they're wearing that we saw during the pandemic. As it appears they're getting ready to transport at least one individual into that ambulance off of the tarmac at Eppley Airfield. We're also watching a little more activity here on the other side of the plane, so I believe we're getting close to seeing some people here get off one way or the other, as there are two stair trucks now connected to this plane, one on the front next to an ambulance, and then the one you see here on the rear side of the plane next to at least 3 passenger vans that will carry most of the individuals off that plane. Back over to the front side of the plane, there you see some lights, looks like some floodlights being set up. At least one individual there now in full personal protective equipment. As they prepare to get the individuals off that plane and on their way to the facility here in Omaha. It is just about 10 minutes past the 3 o'clock hour here in Omaha, and that has been just about 45 minutes since the plane first landed here at Eppley Airfield, obviously taking their time to get everything in order and make sure that all steps are being followed as these individuals are taken off the plane and then transported to UNMC to the quarantine and biocontainment units. Those that do not test positive, those that are not exhibiting any symptoms, will likely ultimately be sent home to carry out the rest of their quarantine, which could last up to 42 days. Others, however, at least one or two exhibiting symptoms and one that is tested positive, will likely stay. The individual that is tested positive will go to the biocontainment unit for close observation and care as needed. There is no actual treatment for the hantavirus. There is no cure. And so all that can be done is essentially supportive care, treating the symptoms and doing what they can. Again, we don't know how long it will take before everybody is taken off the plane at this time. We just see groups gathered at both exit points of the plane. The front of the plane you see here where that ambulance has been parked now for some time. And then also on the rear side of the plane where those passenger vehicles, or passenger vans rather, you see there have been parked. We see another group there that has gathered, presumably getting ready to take those people off the plane. Back over to the front of the plane now, just kind of analyzing what we're seeing here. Again, we see that ambulance there set up at the front of the plane with that stair truck. But we also see an individual there in full PPE, and then other individuals that do not appear to be wearing full protective equipment, but are wearing masks. Again, part of the reason for that may be because the hantavirus is not easily transmissible as other respiratory viruses are, such as the flu or COVID. It does take more prolonged close contact before individuals can be infected. It's not something that can be passed to hundreds of people in an open air environment. It does require close contact. And so that's why, at least so far, we've seen about 6 to 8 confirmed cases aboard a cruise vessel carrying more than 150 people. The hope is that the vast majority of those on board will get through this without having contracted the hantavirus, but obviously they still must go through a pretty lengthy quarantine as the incubation period, that time between exposure and symptoms can range between 1 to 8 weeks. Back over to the rear side of the plane now where those passenger vans are, we do see a number of people now set up there, some of them wearing more full-length gear, others not, but still wearing masks. Can only assume those that are wearing more extensive protective equipment may be the individuals that will be on these vehicles transporting those on board to the various centers at UNMC and Nebraska Medicine. Again, you're watching live coverage of the arrival of the 17 Americans that were on board the Dutch cruise vessel that Hantavirus had spread among several individuals, have now arrived here in Omaha to begin quarantine or containment for those that have either tested positive or are exhibiting symptoms. They will be getting off this plane shortly and making their way to Nebraska Medicine, where world-class facilities can either help care for these individuals or observe these individuals before those that do not exhibit signs of hantavirus are sent home to self-quarantine for a period of about 42 days. Again, at least 17 people that we're aware of on board that were on board the vessel. It's unclear what level of exposure they had to the virus. It is generally not easily transmissible, but because there was human-to-human transmission, which is uncommon, this containment and quarantine is being done out of an abundance of caution, as the hope is that they can limit this spread before it were to enter the general population. So far, health officials remain confident that's exactly what they can do here, as the prevention of additional cases, the prevention of additional exposure and infection can not only limit the spread, but limit the mutations of the virus and hopefully stop it in its tracks. Now, they've had success in previous outbreaks of both hantavirus and other outbreaks of accomplishing just that. Of course, the one exception to that rule is the COVID outbreak, which became a global pandemic. But other outbreaks, including the Ebola outbreak in 2014 and other smaller hantavirus outbreaks, have been successfully contained using these processes. I also want to remind everyone watching us here in the Omaha area, if you're just waking up and getting your day started, we will have full team coverage coming up in just over an hour on First Alert 6 at 4:30. You can watch that on air. You can watch that online on our website, our 24/7 Roku channel, as well as on our app. We will have full team coverage from the airfield to the Canary Islands and, of course, at the medical center. From our team of correspondents tracking this developing story, now taking center stage here in Omaha because of the health facilities we have here to help these people that were unfortunately caught up in a serious health scare and a serious outbreak of a very serious virus. Here's another look at the front side of the plane where that ambulance is set up. Again, not seeing much in the way of new activity here over the last 15 minutes or so. Have not received any timeline of when individuals will be taken off the plane and transported. It's not a very long drive from the airport to UNMC. Obviously, they will be getting a police escort without a doubt. As this motorcade is taken into the facility here in downtown Omaha, just a few blocks from where we are here at Blackstone Plaza. But obviously all precautions are being taken. But the good news is this is not considered to be nearly as contagious as other respiratory infections. And so hopefully they can contain any additional cases from developing beyond these individuals. And the hope is the vast majority of these individuals that were taken off the cruise ship themselves will not contract the hantavirus. But again, since boarding the plane, one individual has tested positive, at least one other exhibiting symptoms. So taking this extremely seriously right now, as the concern right now is the potential exposure or continued spread of the hantavirus. Again, we continue to stand by here as we're awaiting those individuals that were on board the Dutch cruise vessel to deboard the plane here in Omaha. You're looking at a live picture from the front half of the plane. You see an individual there standing next to an ambulance wearing full PPE. Other individuals, at the very least, wearing masks, likely wearing gloves as well. And then on the rear half of the plane, we're also monitoring another set of stairs where 2 or 3 passenger vans have been set up, presumably for the individuals who are not symptomatic and have not tested positive. That they will be boarding those vans to be taken over to UNMC. Our understanding is they will be sent to the quarantine unit, but they won't necessarily be in full quarantine, as they will continue to undergo some monitoring and testing, and ultimately, if nothing changes, they will be sent home to self-quarantine for approximately 42 days. However, at least one person on board has tested positive, 1, possibly 2, have developed symptoms as well. Those individuals will likely stay in Omaha. The individual that has tested positive will undoubtedly go to the Biocontainment Unit, where they will be closely monitored and provided care as needed. So we're just monitoring the activity, as you see there, as we don't know how long it will take for them to get the individuals off the plane. But obviously they are checking and double-checking every procedure that they have to go through here before anything is completed here. But we see that several individuals there that appear to be wearing hats, or excuse me, not hats, masks and gloves, are preparing for some type of transfer. And then at least one individual there you see standing next to the ambulance in full personal protective equipment. Not sure if they are the one that will be in direct contact with any individual that tested positive or will be the one transporting them. But it appears that they are possibly getting some equipment off the plane here first before they get any individuals off of this plane. Again, the plane landed just a little under an hour ago here in Omaha after taking off from the Canary Islands late last night. The plane took off originally from Atlanta, where the Centers for Disease Control and Prevention is located. There you see the rear side of the plane, where we have several passenger vans that have been parked there next to another set of stairs, as we are standing by to see when any individuals will be getting off the plane here and getting on board those vehicles and taken to UNMC and Nebraska Medical Center. There you see the rear half of the plane. You see those 3 passenger vans next to the stair truck, and several other vehicles, likely part of the motorcade that will transport the individuals to Nebraska Medical Center. And then here is the front of the plane, where an ambulance has been staged. We continue to see individuals walking around the plane. I'm going to try and cut to this real quick here. We see an individual walking near the wheels of the plane. Looks like they're looking in with a flashlight at the wheel wells. So not sure if there are various inspections underway before they're going to allow anyone off of the plane. But we can see at least 1 or 2 individuals. You see the flashlight there shining on areas of the plane now. Unclear if that's just a general inspection or just some additional precautions that are taking place because of the high sensitivity of the individuals on board. As we are approaching the 3:30 hour here, just to recap, Nick Weig here with you at the Alert Center here at First Alert 6 in Omaha as we are monitoring the situation on the ground at Eppley Airfield, where a plane has landed carrying 17 Americans that were aboard the ship in which a hantavirus outbreak took place, infecting at least 6 people, potentially a couple more, now that another has tested positive aboard this plane. Of those that have tested positive, 3 so far have unfortunately passed away. The condition of the others is not known. We're told 1 to 2 others have exhibited symptoms on board the plane, and another has tested positive. We have 2 areas of the plane where it appears people will be getting off. On the rear side of the plane, there's a set of stairs with 3 passenger vans, which will likely take most of the individuals on board to the Nebraska Medical Center, to the Quarantine and Biocontainment Unit. And then also on the front side of the plane is another set of stairs where an ambulance is set up, presumably for the individual that is tested positive and possibly for those who have exhibited symptoms of the hantavirus. Generally, the hantavirus is not very contagious. However, this particular strain, known as the aspen strain, is one of great concern. Also of concern is that unlike most cases which come from direct contact with rodents, this appears to have happened originally that way, but unfortunately aboard the vessel there were clear signs of human-to-human transmission, and that is of serious concern because of the lack of any treatments or known ability to prevent death from the hantavirus. The mortality rate among cases, the low number of cases in the U.S. every year is approximately 35%. So more than 1 out of every 3 people who contract the hantavirus are at risk of passing away. Again, we're standing by for the final go-ahead to get the individuals off of this plane that were on board that Dutch cruise vessel. Standing by to see if we're getting any other information from officials. We have not received anything since the plane has landed. But again, we continue to stand by as we do expect the individuals to get off the plane here at any moment. But obviously, a lot of precautions being taken in the meantime before anybody gets off the plane. Again, I want to thank everyone for joining us. Obviously, a lot of interest around this story, both here in Omaha and around the world. Oh, Terry, that's correct. Andy strain, not the aspen strain. I do apologize for that. I got my A's mixed up. Yes, it is the Andy strain. You are correct. Thank you for that correction there. I do appreciate that. I will chalk that up to the early or late hour, depending on what one end of the day you're joining us. It is very early in my case here on a Monday morning here in Omaha. But obviously, we want to bring you this live coverage, not because there's any concern for the public. We do want to stress that because of the known ability for this virus to transmit and the precautions being taken, there is no reason for the public to be concerned. But obviously, this is a world story that is now becoming at least partially focused here on Omaha because of our world-renowned care facilities that can not only help these individuals, but make sure that it is contained and does not continue to spread in the public, because that obviously, as we all know, unfortunately, from the COVID pandemic is the absolute worst case scenario, because even if it doesn't transmit easily, continued transmission in the public means continued mutation, and viruses, like any other organism, will do what it can to survive, and that means trying to find ways to spread further. In every other instance of a hantavirus outbreak, World Health officials have been successful in containing it, and there is, at least for now, there remains high confidence that they can do it again. The unfortunate thing is that there were a number of human-to-human transmissions, unfortunately, because of the circumstances on board a cruise ship. Obviously, more people in close proximity to one another, further complicating matters. But the hope is, now that that ship, all the patients on board have been taken off, all the individuals have been taken off, that further quarantining efforts at their countries of residence will stop this in its path. That is the hope, and there are few places in the world better suited to handle a situation like this than the Nebraska Medical Center at UNMC here in Omaha. So we continue to stand by now more than an hour after the plane has landed here in Omaha. We're not sure for the delay if there's something unexpected that has come up, or if this is just part of the precautions. Obviously, there is a lot of precautions going on right now before they will begin to transport these individuals from Eppley Airfield to the medical center here in downtown Omaha. As we've been showing you all morning long since the plane landed, there are 2 stair trucks set up that appear to be ready to take people off the plane. One here you see live right now at the front of the plane where an ambulance has been set up, and then another on the rear side of the plane where we have several passenger vans set up, presumably to take most of the individuals that are not symptomatic and have not tested positive to the medical facility. Not sure if they're heading directly to the quarantine unit, but we're being told that they will not be placed into a quarantine situation. They will be monitored and eventually sent home to self-quarantine for a period of about 42 days. And there you see those passenger vans on the rear side of the plane, where we expect to see most of the individuals on board get off and get on those vans for the hospital. Obviously not getting any information from the officials there on the scene. We are being kept understandably quite a distance away from this site. Fortunately, we do have some rather large zoom lenses that can get us a little bit closer. The authorities kind enough to get us into a staging area where we could get images like this, because obviously this is not happening at the terminal. This is all being kept away from anybody else working or traveling through the airport early this morning, as efforts continue to basically contain this as best as they can. There you see on the backside of the plane, we're seeing a number of people now in full what we call PPE, personal protective equipment, beginning to gather, wearing those hoods, those full body kind of plastic biosuits designed to prevent infection. And not sure if this means we're going to be seeing some people getting off the plane here soon. Obviously, this is a situation that the CDC has dealt with in the past. This is a situation that Nebraska Medical Center has dealt with in the past. During the Ebola outbreak of 2014, several individuals were brought here to Omaha because of the facilities here. This is the home of the only federally funded containment unit, as well as the quarantine unit here as well. Now, we don't expect that those asymptomatic that have not tested positive to be under strict quarantine here in Omaha, but they will be monitored and checked out before they're sent home for a self-quarantine of some 42 days. Now, those that are symptomatic, those that have tested positive, we know of one that has tested positive. They will likely be housed in the biocontainment unit here in Omaha until they are given a clean bill of health. Now, it's understandable after everything that the country has been through that when you see scenes like this, you see several people standing around in the full protective gear. It brings back some of the darkest images from the COVID pandemic. But all of these measures are being taken to prevent exactly that. They don't want to see this virus continue to spread, continue to mutate into something more easily transmissible. This is a very dangerous virus. Generally, more than 1 out of every 3 in the United States that has ever contracted this virus has died. There is no treatment. There is no known cure. There is no vaccine. These are all things that may be considered in the future, but right now there is no effective treatment. And so all that can be done for anybody who contracts the hantavirus is supportive care, treat the symptoms, and do everything you can for the patient and hope that they come out of it on the other end okay. But unfortunately, many people who contract the hantavirus are not that lucky. So understandably, these significant precautions are being taken, and these people are being brought to Omaha because of the level of care and expertise and facilities that we have available here in Omaha. There you see the front of the plane where that ambulance has been set up at another set of stairs. Yeah, one of our viewers on YouTube, the WHO is a great organization that has done a lot. Yeah, the World Health Organization has spearheaded this response, as is often the case in outbreaks that impact people from several countries or are taking place in several countries. We're going to cut to our other shot here as our camera's getting reset. They have been at the forefront of this, managing this response and coordinating with multiple agencies, multiple countries to do what's best to not only care for these individuals and get them someplace safe, but to also ensure that they prevent the further spread of the Hantavirus beyond this cruise ship. We do need to point out there were some individuals who got off of the boat before, that may have been exposed before the Hantavirus had been detected. And so those people may have come in contact with others, and there is contact tracing going on around the world to ensure those people are notified and at least conduct precautionary quarantines. This is a strain of the virus that unfortunately has been transmitted human to human, which is not often the case. That is why there is a serious concern here. But the hope is, because it does require much more close contact than, say, the flu or COVID, that they can still prevent this from turning into a full-blown multi-continent outbreak or, worst-case scenario, a global pandemic. Right now, all of the cases detected have been limited to individuals on board that vessel. They are now being placed under various quarantine protocols in their home countries, and that is what you see happening here in Omaha right now, as the facilities here will be able to not only care for those that have been struck with hantavirus, but will be able to ensure that those who are going into their own quarantine are prepared for any eventuality. Again, the WHO, as well as the CDC here in the United States, says that there remains no reason for the general public to be alarmed. They believe that they have been able to trace all cases tied to this, and those that may have been potentially exposed have been notified and are taking the proper precautions, and that they can prevent this from spreading further. This is a virus that has had outbreaks in the past, both here in the United States and around the world, and World Health officials have been successful in preventing it from becoming a larger outbreak. Obviously, here in Omaha, they not only have experience with biocontainment and quarantining from the pandemic, but also individuals that were infected by Ebola in 2014 were brought to the Biocontainment Unit here in Omaha, others quarantined here in Omaha, and the effort to prevent that outbreak from spreading was successful. Echo over on your YouTube page, potential 1 to 8 week incubation period. Yeah, that's right. We've been talking about that too, that this incubation period, this is what's really different with the hantavirus compared to other viruses we've dealt with in recent years, is that its incubation period is extremely long. And what that is the period between exposure and the development or the onset of symptoms. And generally, you know, when you have a cold or a flu or COVID, it can be anywhere from maybe 2 to 4 days. But with hantavirus, it can be 1 to 8 weeks. And so that is why those that may or may not have been exposed on board this ship are going to be in quarantine for a very long time, because they want to make sure, no matter what, that anybody infected does not infect anybody else. As you can see, we have been monitoring 2 areas of this plane. There are 2 stair trucks, one on the very rear of the plane, one at the very front of the plane. The one on the front of the plane is where we see an ambulance that is staged there, and then the one on the rear of the plane that you see on your screen right now is where we have 3 passenger vans. Presumably that is where the majority of the passengers will go. Those that have not tested positive, those that are not exhibiting any symptoms, they will be boarding those vans and heading to the medical facilities here in Omaha to be checked out not officially being placed under the quarantine unit here. I would expect that's still going to be involved, but ultimately they will be sent home to be allowed to self-quarantine if they're able to, and obviously they will be under strict orders to report any symptoms that may develop. But the hope is the vast majority of individuals on this plane that were on board that vessel will never come down with the hantavirus. But they have been exposed, and so obviously out of an abundance of caution to prevent the spread, they will go into quarantine. Terry over on YouTube says those who are non-symptomatic are also non-contagious. Yes, that is a very important differentiator between this and what we experienced with the COVID outbreak. Is as the COVID virus continued to mutate, we began seeing that people who had not exhibited symptoms were already becoming spreaders of the virus. There is no indication that that is what has happened here with the hantavirus, but in the event that that is possible, that is why you're seeing these measures being taken, these quarantining requirements being put in place, so that if that is possible and has simply not been detected yet, the bases are covered. So they are obviously going to do everything they can to ensure that the cases do not spread beyond the individuals who are on board this vessel, and that they can prevent as many infections and as many loss of life as they can. As we're getting closer to the 4 o'clock hour here in Omaha, we continue to stand by as we await the individuals aboard the plane here that has flown from the Canary Islands with 17 Americans that were on board the Dutch cruise vessel. Has now arrived here in Omaha, and we have been standing by now since it landed about an hour and a half, a little over an hour ago, I guess, for them to begin to deboard the plane. There you see it is a very, as we zoom out here, it is a very large plane, and so you see at the very front is where we see an ambulance ready to take individuals off, and then at the very rear we see individuals that will likely get off to board several passenger vans. And you can see there's obviously a lot of room in between those two exit points. Again, this is not a virus that's very easily transmissible through the air. It does require a little bit more prolonged close contact, and so again with the this was something that was talked about a lot during the COVID outbreak with passenger planes. Obviously the environmentals on a passenger plane are actually quite good once you get in the air because of the amount of circulation. So as you can see by the size of the plane, there is a lot of space and separation between individuals that have shown no signs of hantavirus and presumably those that were in the front that have either become symptomatic, or the one individual that we know of that has tested positive for the hantavirus. So obviously a very large plane for 17 people and support crew to be able to keep people as separate as possible if need be. And it appears that is what has happened here, as we're seeing probably the two exits most distant to each other is where we're going to see people get off this plane.
One
Again, I want to thank everyone who's joining us at this very early hour as we are monitoring the developments out at Eppley Airfield, where the plane carrying 17 Americans that were on board that Dutch cruise ship in which the Hantavirus was detected have now landed here in Omaha to be processed. Some will go into biocontainment, some may go into quarantine. Ultimately, others will be evaluated and then ultimately sent home to self-isolate for approximately 42 days. We now know that one person on board the plane since departing the ship yesterday has tested positive. We do know that others, at least one other, if not two, have now begun exhibiting symptoms. However, they have not tested positive, and that there are more than a dozen others that are asymptomatic and have not tested positive and possibly don't have the hantavirus at all. But out of an abundance of caution because of the seriousness of this virus, the United States and all other countries are taking this very seriously to ensure that this virus does not spread any further than it already has. Now, the early reports from the World Health Organization is that this outbreak may have started with an older couple that were taking a vacation to look at birds in South America. They reportedly were bird watching at or near a landfill, and that is where they likely became exposed to rodents carrying the hantavirus. That is the most often way that this virus does infect humans, because this is a virus that we do see, especially in the desert Southwest, in a small number of cases every year, and it is quite fatal. Here in the United States, about 35% of all people infected unfortunately pass away. The couple that became infected then boarded a cruise ship that traveled to Antarctica and back to the north. The husband became ill and passed away, and then the wife became ill and passed away, I believe they said about 2 weeks later. Unfortunately, there were individuals who got off of the boat after this had all taken place, but before it was confirmed that it was the hantavirus. Obviously, the symptoms of the hantavirus do mimic other more common ailments, and so it wasn't until further testing was done that they determined that this was the hantavirus. No one else, once that determination was made, no one else was allowed to leave the ship. It took several days to find a port that would allow them to dock so they could get everybody off the ship. That is what happened at the Canary Islands yesterday. And then the more than a dozen countries with citizens on board that ship made plans for them to be transported safely to conduct quarantine or treatment in their home countries. And so that is what you are seeing here live from Omaha, as the Americans on board that ship have arrived here to be treated, evaluated, or quarantined here at our medical facilities at Nebraska Medicine. This is something that Nebraska Medicine and UNMC has a lot of experience in. They did the same thing for patients during the 2014 Ebola outbreak, which was successfully contained, and then also in the early days of the COVID outbreak, which unfortunately did develop into a global pandemic, killing millions. But obviously, there is a lot more that needs to be done in terms of containing this, and that is what is happening both here in Omaha and around the world as global health officials are responding to this outbreak in hopes of preventing it from spreading any further. As we are now approaching the 4 o'clock hour here in Omaha, we are still standing by for any updates on the when the individuals will be getting off the plane. Obviously, there's a lot going on before they do get off that plane, but we are at this moment not getting updates from officials on when any transfer will get underway here at the airport. So we continue to stand by as this motorcade will ultimately make its way to Nebraska Medicine and UNMC, which house the Biocontainment Unit and the Quarantine Unit. We have not received any new information from authorities since late last night when we learned of the one individual on board that has tested positive, and that at least one or two others are exhibiting symptoms and are being closely watched. We do expect a news conference here in Omaha coming up at 9 o'clock this morning, local time, Central Time here in Omaha. So about 5 hours from now, we will bring that to you live when that happens, as we continue to monitor the latest out at the airport. We have multiple crews there on the scene. At the airport, we have a crew standing by at the hospital whenever this motorcade gets underway. You see there in our live picture, there are 3 passenger vans on the rear side of the plane. We also have another staircase on the plane on the front end where there is an ambulance standing by, but right now no word yet. Looks like if I can see a little more closely, we may have seen an individual there in PPE possibly spraying something on the ground, some kind of disinfectant. But still a lot of people mulling about, some wearing full personal protective equipment, some just wearing gloves and masks. You know, we've been talking about how this is an infectious strain of the Hantavirus. There has been confirmed human-to-human transmission, but still does require somewhat close contact, more close contact than you see with something like the flu or more recent strains of the COVID outbreak. But obviously, still a lot of precautions being taken here before they get these individuals off the plane. Again, we are being kept at some distance from the plane. The authorities there on the scene were kind enough to set up a staging area for us so we could at least get pictures of what has been going on as this transfer takes place from the plane to those waiting vehicles. But we continue to stand by here at the airport, awaiting the transfer of the Americans that were on board that ship. We're also standing by at their destination here later this morning. This is a live picture from Nebraska Medicine at UNMC here in Omaha, where those 17 Americans will be taken once they get off the plane. The one that has tested positive will certainly be placed into the Biocontainment Unit. The others will be checked out. There's at least 1 or 2 now exhibiting symptoms. They will be checked out. Those that have not tested positive, that are not showing symptoms, will be checked out, and it sounds like they will be allowed as long as nothing changes, they will be allowed to self-quarantine at home. But it's not clear exactly how that transportation will take place at this time. That quarantine period is expected to last about 42 days. Back out live now at the airport, where again we continue to stand by as we have for the last hour and a half. No one has gotten, no Americans from that ship have gotten off the plane as far as we're aware, but we have seen crews there mulling about, many in full body protection, those biohazard suits, as they are making preparations to get the individuals off the plane and get them to the hospital. As this is just the latest unexpected stop for the people on board that ship. They were finally allowed to port at the Canary Islands yesterday. The CDC sent a plane from Atlanta to the Canary Islands to pick them up with health officials on board and other experts, and they were flown straight here to Omaha overnight, landing about an hour and a half ago here at the Eppley Airfield, and obviously being kept away from the terminal, and we are standing by for them to get off the plane and get on those passenger vans, and then the one ambulance on the other side of the plane, and be taken to the medical facilities here in downtown Omaha. If you're just joining us, this is not the first rodeo for the Nebraska Medicine at UNMC. This is a world-renowned facility here in Omaha, known for its biocontainment unit and quarantine facilities. It was utilized in the early days of the pandemic. It has also been utilized in the 2014 outbreak of Ebola, when individuals were brought here to the United States for care. In that case, obviously, the containment was successful, and that outbreak was ultimately contained. And the hope is they can do the same here, as all of the cases so far confirmed have been aboard that cruise ship, and they can prevent this from spreading any further anywhere else around the world. Again, as we've now passed the 4 o'clock hour, and we continue to stand by for any word on when the transfer at the airport will happen. We want to remind you that we will have full team coverage coming up at 4:30 here on First Alert 6. We will have our full morning coverage throughout the morning. We will stay with you here on our social media streams for continued live coverage, and continue to monitor the situation both at the airport and then at the hospital, where we do expect a news conference to get underway at about 9 o'clock this morning local time, so about 5 hours from now. We, of course, will bring that to you live as well, as this is become the center of attention for the American response to the Hantavirus outbreak aboard that Dutch cruise ship. Again, there are 17 Americans on board this plane that were on board that vessel. They are going to be taken to UNMC, Nebraska Medicine, where the individual that is tested positive will be placed into the biocontainment unit. The other individuals exhibiting symptoms, we're not clear as to what their treatment plan will be. Those that are not showing any symptoms or signs of infection will be checked out, and right now at least the plan is that they will be placed under quarantine, and they will be allowed to serve that quarantine at home for about 42 days. As we continue to stand by here, want to go back to how this all started today. The operations, or excuse me, yesterday, it is Monday now, I apologize. Operations to evacuate the passengers from the vessel Hantavirus concluded on the Canary Islands yesterday. Those 17 American passengers now in Omaha. were picked up there to be brought to the special quarantine unit here for screening and assessment. Now, as we said, most of the passengers, like the Americans here, most of the passengers on board the vessel remain not showing any symptoms or asymptomatic. One evacuee heading to France began showing symptoms during the flight home. We know of at least one or two aboard this American flight that have begun showing symptoms, and one that has now tested positive. For more on how this all played out at the Canary Islands, here's Melissa Bell.
It was at sunset that the operations this Sunday to evacuate passengers from the MV Hondius came to an end. The very last passengers to be disembarked, these 17 Americans who, like the others, had been stuck on the ship for more than 5 weeks. They were taken to shore, as had the French, the Dutch, all the other nationalities over the course of the day, by small boats and in batches of 5, brought ashore, taken through a tent, put on a bus, and then taken to the waiting plane ready to carry them back to Omaha, Nebraska. From there, they go on to the special quarantine unit, where it is, we understand from CDC officials, they will be screened, assessed, and then it is hoped, for the most part, allowed to carry out their isolation period back home. Different protocols for different countries. We have had the news that amongst the French passengers that were evacuated earlier in the day, one of them had begun showing symptoms on the flight home. Special procedures now being put in place by French authorities around that passenger. But the end of a successful day of operations here at the small port of Grenadier. They will continue on Monday. The very last passengers to be taken off the ship will be the Australians, and then we understand that the ship itself will head back to Rotterdam for a full disinfection, with some 30 crew members still on board. Melissa Bell, CNN, Tenerife.
Back out live now to Eppley Airfield here in Omaha, where that plane has landed just about an hour and a half ago. And we continue to stand by for the Americans on board that Dutch cruise vessel to get off the plane and get on the passenger vans you see there to the medical facilities here in Omaha. Now, this is, of course, a very serious situation, but health officials stress this is not a repeat of COVID. They are doing everything they can to make sure that this remains as contained as possible. The acting director of the Centers for Disease Control and Prevention has been pushing back against the criticism his agency has received over their response to the Hantavirus outbreak. Health agencies continue to stress that the broader risk to the public remains low, and that there is no reason at this time for the public to be panicking about a larger outbreak.
We're going to interview them and assess them for risk. Risk meaning, in this case, risk doesn't mean the risk of dying from the disease or anything. The risk is a high risk if they've been in close contact with somebody who was symptomatic. If they weren't in close contact with someone who was symptomatic, then we're going to deem them low risk. If they were in close contact, we're going to deem them medium or high risk. At that point, we will offer them alternatives.
And as we've been reporting, those alternatives for those that are deemed at low risk will be self-quarantining at home for the next 42 days approximately. Back out live now, there you see the plane here in Omaha that landed from the Canary Islands about an hour and a half ago, where since departing the islands, one American on board has tested positive for the hantavirus. At least one other is exhibiting symptoms as well. And that may also explain why the abundance of caution in the slow deboarding process here is that is a little bit more serious than what they had planned on when the plane left the Canary Islands, as some of the members or some of the passengers on board have fallen ill, and one has tested positive for the hantavirus. So obviously every precaution being made to ensure that there is no further exposure, there is no further spread of this disease, which is very, very dangerous. There is no known treatment. The mortality rate among cases here in the United States is around 35%. There are cases every year, largely confined to the desert Southwest, but rarely has there ever been noted human-to-human transmission of the Hantavirus, and the fact that that has taken place aboard this cruise vessel is why it's such serious concern, because human-to-human transmission generally is very difficult, but with this particular strain that is known as the Andes strain of the Hantavirus, that has taken place, and deeply concerning as authorities hope to prevent further spread of this around the globe. Now that the passengers on board the vessel have been removed and have been returned to their home countries for ongoing quarantine and or treatment. In the case of the United States, there were 17 Americans on board, and they are now on board this plane that has landed here in Omaha. And we are standing by for them to get off that plane, where they will then be motorcaded to UNMC Nebraska Medicine here in downtown Omaha for treatment, evaluation, and hopefully for most of them, they will be allowed to quarantine at home. However, we're not sure if the situation with that changes now that one has tested positive and another is exhibiting symptoms. A lot of that will depend on each individual and their level of exposure to these individuals that have now fallen ill or tested positive. And so that will be up to the medical professionals here in Omaha. Again, it is coming up on 4:15 here in Omaha. I want to remind everybody that is watching us from the metro area and here in eastern Nebraska that First Alert 6 at 4:30 will get underway at 4:30. So you can continue to watch our live coverage here, or if you want to get an update on the latest headlines, we will have team coverage on First Alert 6 on this, but we will also have the other headlines of the day as well as your First Alert forecast. But right now, we will continue streaming this. We will be dropping off of our 24/7 streaming channel on our website so that the newscast can take over here in a few minutes. But we will continue streaming this live coverage for you on our website as well as on our Facebook page. You can also find us on YouTube, where you can obviously like this video, subscribe to our channel, and make sure you ring that bell so you can get alerts when we go live for breaking news, live coverage, severe weather, anything happening here in eastern Nebraska and the Omaha metro area. We do bring you severe weather coverage here live when it happens. And obviously when breaking news warrants, such as this, we will always bring that to you live on our YouTube channel. We're also streaming live on our Facebook page as well as TikTok and Twitch. So any way that you want to follow us, we will make sure that you have access to all of our breaking news coverage when it happens. But right now, that focus is on the plane at Eppley Airfield here in Omaha, where we are standing by for Americans who are on board the Dutch cruise ship that experienced a hantavirus outbreak to get off the plane, and they will be transported to UNMC Nebraska Medicine here in downtown Omaha. Not sure what happened to our live image here. Let me see if we can get it back. It looks like we may have lost our live picture from the airport here. So we'll go ahead and come back out here live. I do apologize for that. We'll see what happened to our live picture from the airport. see if we can get back in touch with our crews there. But we appear to have lost all of our live pictures from the airport, so we will do our best to get those back. Again, we are standing by for the individuals on board the plane to get off the plane. We'll get those live pictures back for you. We're working to figure out what happened there, but again, we are standing by for the 17 Americans that are on board that plane to be taken off and transported to UNMC Nebraska Medicine. Looks like we got one of our live shots back at the airport, so let's go ahead and take you back out there live. There we go. So there you see there still that ambulance there on the front side of the plane, along with the stair truck. And again, as we have for nearly 2 hours now since the plane landed here in Omaha, we continue to stand by to see when anyone will be taken off of the plane. Again, a reminder here, coming up in about 10 minutes at 4:30, we will begin First Alert 6 at 4:30, which you can watch on air. You can watch it on our website as well. But we will continue here on our social media channels to bring you this live coverage from the airport as we are standing by for the transport of the 7 Americans on board that cruise ship where the Hantavirus outbreak took place. We are also planning on bringing you live news coverage, or news conference rather, at 9 o'clock this morning from UNMC and Nebraska Medicine, where they will update us on what is going on with the patients, the procedures that are being undertaken. So that will likely be our first update since getting word that an individual on board has tested positive for hantavirus, and one, if not 2 others now, are exhibiting symptoms that could indicate that they have contracted the hantavirus. As we continue to stand by for the Americans on board to be taken off the plane, we want to remind you that we have, as we've been talking about since Friday when we first got word that the Americans would be coming to the facility here in Omaha, that there is a world-renowned facility here in Omaha to not only conduct biocontainment but quarantine as well. The National Quarantine Unit here in Omaha being an example of that. It's a place that leaders liken to kind of a dorm or hotel setting. As you can see here, some of the quarantine units do include basic bedroom furniture, as well as exercise equipment, and they would be, anyone who does end up in the quarantine unit will be allowed full contact with family and friends, and be provided the facilities needed to do so. I guess one good thing about the modern era is quarantine doesn't mean complete isolation, but obviously being able to communicate with loved ones is welcomed in such a stressful and uncertain situation. The facility is also home to the Biocontainment Unit, where leaders and experts would gather to care for anyone like the individual that has tested positive. They will be isolated in this unit, and authorities will be coordinating with other experts from around the world to compare notes and discuss what's being done, what can be done, and any other potential avenues. Now, this all took place after this morning when the passengers on board, you see here, leaving the cruise vessel this morning in the Canary Islands. At least 6 cases have been confirmed. Among those, 3 people have died. We have learned of another case now among the Americans since leaving the Canary Islands. As we believe the Americans were among the last to leave the vessel. There's about 30 people that remain on board. They are all crew members that will remain on board as they depart to another port where they will begin the decontamination process to ensure that there is no ongoing contamination on board that ship. Back out live now to Eppley Airfield here in Omaha, where we continue to stand by. We have not seen any of the presumed passengers be taken off the plane as of yet. We're not sure if this is a planned procedure or if there's a delay because of the developments while they were in the air of some passengers exhibiting symptoms and at least one now testing positive for the Hantavirus. This plane took off yesterday from Atlanta, which is the headquarters of the Centers for Disease Control and Prevention, and then picked up the passengers at the Canary Islands. It took off late last night and arrived here in Omaha just about 2 hours ago. Since arriving here in Omaha, they have been left here on the tarmac with several passenger vans standing by and an ambulance standing by. But as of yet, we have not seen any of the 17 Americans that were on board that cruise ship taken off the plane. Eventually, once they are removed, they will be motorcaded to Nebraska Medicine at UNMC here in downtown Omaha for a treatment and evaluation. And then we hope to get an update scheduled for 9 o'clock this morning from the hospital and from the medical leaders there as to what's being done, and hopefully we will be provided an update on the condition of those that are either exhibited symptoms or have tested positive. But obviously we're left to do nothing but wonder why it is taking so long to get them off the plane after landing, but we don't know if that's because of something that was planned or if that new developments have caused them to delay getting them off the plane. That is the issue that we're working to get some answers on right now. Again, we have crews at the airport, crews at the hospital. We have several people here in the newsroom working to gather information. We've been working around the clock to get the latest as this plane has come here, and there was some discussion about whether it would land somewhere else or make a stop somewhere else. Ultimately, it did not. It came straight here to Omaha as originally expected, and now we are standing by for any new developments. Again, I want to remind everyone, if you're watching us here in the Omaha area, First Alert 6 at 4:30 gets underway on air here, coming up in just a few minutes. We will also have that live on our website, and we will drop off in a moment so the newscast can take over there in a few minutes. But we will continue our live coverage here on our social media channels, Facebook, YouTube, TikTok, and more. And we will continue to bring you these live pictures and any updates from our crews on the scene as they come in. Again, we have crews both at the airport here in Omaha as well as at the hospital where these 17 Americans will ultimately wind up later this morning as their continued evaluation continues, and we hope to get a full update on their condition and what comes next for all of them. There is a news conference scheduled for 9 o'clock this morning at the hospital. We will, of course, bring that to you live here on First Alert 6 for the very latest when that does take place. But again, just to recap before we drop off for our newscast here on our website, right now health officials say there is no reason for the public to be alarmed. They believe that they can contain this. This is not as easily transmissible as other outbreaks as we have seen in the past, particularly the COVID pandemic. This is not as contagious. They are still remaining hopeful that they have this contained to the individuals that were on board the ship, and they can keep it that way with the right precautions. And that is why these individuals from the United States have been brought here to Omaha, because this is a place that is well suited, both now and in the past, to handle the proper containment, treatment, and quarantine for individuals impacted by outbreaks such as this. The Hantavirus is a very dangerous disease. It is very highly fatal. There is no known treatment. And so that is why all of these precautions are being taken to prevent this from spreading any further than it already has. Okay, it is now 4:28, and we're going to go ahead and drop off of our website here. And if you're joining us on our website here in just a moment, you will see First Alert 6 at 4:30 for more coverage of the arrival of the Americans on board the cruise ship that was subject to the hantavirus outbreak. And we will continue our live coverage here on our social media channels. Okay, as we approach the 4:30 mark here on a Monday morning in Omaha, we continue to show you live pictures from Eppley Airfield in Omaha, where we are standing by for passengers on board the Dutch cruise ship that experienced the hantavirus outbreak to be taken off the plane and transported to Nebraska Medical at UNMC. We are awaiting. It's been 2 hours since the plane landed, and none of the passengers that we're aware of have gotten off the plane. We are working to figure out why, if this is an expected delay or if this is something else going on. We do know that since leaving the Canary Islands late last night, that 2 individuals that were on board the ship that are on the plane have begun exhibiting symptoms. At least one has tested positive now for the hantavirus. And so it is unclear what if that may be leading to some extra steps that are being taken before anybody is taken off the plane. We've been bringing you these live pictures now for a little over 2 hours now, as obviously a lot of attention is being paid on the passengers aboard the ship, as they have been brought to, most have been brought to their countries of origin for treatment, evaluation, and quarantine. In the case here in the United States, those that have tested positive will be taken to the Biocontainment Unit here in Omaha. Individuals that are exhibiting no symptoms and have not tested positive will be checked out, and they may be allowed, depending on the circumstances, to be to self-quarantine. However, now that individuals have begun exhibiting symptoms and testing positive, that may change for some others, depending on their level of exposure to those that have now fallen ill or tested positive. Now, despite all this, because this was all taking place on a cruise ship, there is a level of confidence among health officials that they do have this outbreak contained and that they are doing everything they can to keep it that way. But again, every precaution is being taken, both by officials here in Omaha, the Centers for Disease Control and Prevention, as well as the World Health Organization, which has been spearheading the global response. And although there's been a lot of talk that the United States did end its membership in the World Health Organization, there has been coordination between national and international partners to make sure that everybody is on the same page when it comes to responding to this outbreak of the Hantavirus. As we have been reporting, we have crews on the scene at the airport. We have crews on the scene at the hospital right now. We continue to stand by for any updates. We are checking with authorities here in Omaha to determine if this is an unexpected delay or what may be going on at the airport right now in regards to getting individuals off the plane. But we have gotten no word yet, but we are continuing to try and get any information that we can get from officials as to what's going on. Now, regardless of what happens, we do expect, at least at this time, to get an update at 9 o'clock this morning from leaders here in Omaha on the situation. Hopefully, we will get at least an update on the condition of those brought here and what the plan is for all of them. But again, the plane landed a little over 2 hours ago now from the Canary Islands. And as far as we're aware, none of the 17 Americans that were on board that Dutch cruise vessel have gotten off the plane here in Omaha. So we continue to stand by to figure out what's going on here. We don't know if this is unusual or not, but we are trying to find out why those on board have not been taken off the plane now after 2 hours since landing here in Omaha. Again, this is Nick Weig live at the Alert Center here in Omaha, where we continue to monitor the situation at Eppley Airfield, where the plane carrying 17 Americans that were on board that Dutch cruise vessel landed a little over 2 hours ago now after departing the Canary Islands. Since departing the Canary Islands, one individual on board has tested positive for Hantavirus. At least one other has begun exhibiting symptoms of the Hantavirus. Now, before those developments, we were told that that the individuals on board that had not tested positive, had not exhibited symptoms, would be taken in for evaluation and then would be sent home to self-quarantine, which appears to be kind of what most countries are opting for right now. But we don't know if these developments while flying here to Omaha have changed anything. We are simply in a holding pattern right now, as it appears everything at the airport right now is in a holding pattern. We were just checking the flight board at the airport, and the first flights of the day are scheduled to take off, and they're still scheduled on time right now, are scheduled to take off here in less than an hour. Right now, there are no flight delays at the Omaha airport because of this situation. Don't know if this will change anything because obviously the plane is not at a terminal. It is out in its own area right now away from other passenger planes. So hopefully that if you have any travel plans out of the Omaha airport today, hopefully things will continue to be running on time. And as of right now, all flights in and out of the Omaha airport are scheduled to be on time.
Position 2, UAD. Position 2, yes. Position 3, UAD. 388. Position 7, UAD. Affirmative. Position 8, UAD. Beacon. Affirmative.
Again, I want to thank everyone that's been joining us this morning as we continue to bring you live coverage from the Eppley Airfield here in Omaha, where 17 Americans that were on board the Dutch cruise vessel that was the site of a Hantavirus outbreak have been transported from the Canary Islands late last night here to Omaha with medical facilities designed to handle a situation like this. It has been now more than 2 hours since the plane landed here in Omaha at about a little after around 2:30 this morning, and now here we are at about 4:38, and we have not seen any of the individuals get off the plane. We have been monitoring 2 exits on the plane, one on the rear side of the plane. You see there live right now where those 3 passenger vans have been standing by for some time now, and then the other on the front side of the plane where an ambulance is standing by. But we continue to stand by and see when anybody may get off this plane. The plane did take off late last night from the Canary Islands, where the cruise vessel was finally allowed to port and get everybody removed from the plane, or from the boat rather, with the exception of the crew of the boat, which will remain on board as they head to another port for decontamination. But all of the passengers were removed. More than a dozen countries have taken them in, largely those that had citizens on board and are conducting their own health protocols, largely treatments and evaluations and quarantines, self-quarantines. And that is the plan here as well. But unfortunately, since taking off from the Canary Islands, we've learned 1 American has tested positive for the Hantavirus. At least 1 other has begun exhibiting symptoms. We don't know if those developments are the reason for this delay. We don't know if this delay is unusual or if it's just simply part of the process that they're carrying out right now to ensure no further spread. But for whatever reason right now, the individuals that were on board the vessel now on the plane have not come off the plane now for more than 2 hours. So again, this is not happening at the terminal. This is not happening anywhere near where the public is. This is happening in its own isolated area of the airport. We just checked the boards at the airport. Everything does remain on time when flights begin taking off here in about 45 minutes. So as far as we're aware, that is still the plan as we continue to stand by for any new activity with the plane carrying those that were exposed to the Hantavirus. Again, we continue to check with our sources on what may be happening. We've also checked in with our friends at NBC News, which also have a crew on the scene. And so far, to our knowledge, nobody has given any indication as to exactly whether or not this delay was expected or not. And therefore, we still don't know the reasons for this now 2-hour wait before anybody has gotten off the plane. So we are continuing to stand by here and bring you any information that we do get from authorities. If nothing else, we will be bringing you live coverage of a news conference that for now has been scheduled for 9 o'clock this morning at the hospital here in Omaha. Hopefully we'll get some updates at that time. Beyond that, all we've received from health officials here in the U.S. is that one individual on board the plane has tested positive. At least one other has begun exhibiting symptoms, but we're continuing to try and get some answers as to what's going on right now, because we're now well over 2 hours since the plane landed and made it to this portion of the airport away from the terminal. And we've seen plenty of vehicles getting in position to take people off the plane, but we have not seen any actual people get off the plane. So that is the latest that we have right now. We will continue to keep these live pictures up and bring you any information that we can. But like everyone at the airport right now, we're just kind of in a holding pattern. If you do have a flight in or out of the airport today, right now all flights are on time. There's been no reported delays for both arrivals and departures. But again, right now we're just standing by to get more information from anybody on the ground as to what the next steps are here for the 17 Americans on board that plane. And good morning again, Nick Weig here with you. It is now 4:49 a.m. here in Omaha in the central part of the United States, and we are continuing our live coverage from Eppley Airfield here in Omaha, where the plane carrying 17 Americans that were on board the Dutch cruise vessel which experienced the Hantavirus outbreak has landed. It landed over 2 hours ago. We are seeing a little bit more activity on the ground, but we still haven't seen any of the passengers get off that plane. We're not sure if this was an expected delay, but this does come after we were notified late last night that one individual on board the plane had tested positive, and at least one other individual had begun exhibiting symptoms. We don't know if that's part of the reason for this delay, but at this point, we are just standing by to see what happens next. The next official update on the situation is expected to come at 9 o'clock this morning, so in about 4 hours from now, from UNMC, Nebraska Medicine, where the National Quarantine Center and Biocontainment Unit are located here in downtown Omaha. And we will continue to stand by, and we're still working to get any information from authorities on the scene. We've also been talking to our partners at NBC News, and right now, no word from anybody as to whether or not there is a reason for this delay to transport the individuals on board. As we are seeing, as I said, a little more activity, some more movement among vehicles and individuals. But as for the ambulance you see there directly behind the plane near the front stair truck, and then the 3 passenger vans next to the rear stair truck, we have not seen any movement of any of those vehicles, nor have we seen anybody come down the ladders or the staircases as of yet. Now, despite this seeming delay, we have been monitoring the boards at Eppley Airfield, and at last report, we do not see any delays to arrivals or departures at this time. The first departure scheduled at the Omaha airport is 5:19 this morning, so in about another half an hour or so, we should see flights departing the airport. There you see a number of vehicles leaving the scene, but again, we have not seen anybody depart the planes as of yet. We are seeing those passenger vans moving now, so it's possible that maybe we did see. We're not sure if individuals got off the plane out of our sight. We were looking from the back side of those stair trucks. So again, we see the ambulance and the passenger vehicles, or the passenger vans rather, now moving away from the plane. Apparently get what appears to be getting an escort. So hopefully we just simply missed the deboarding here a short time ago, and things are now proceeding. There you see the ambulance and the 3 passenger vans we saw alongside the plane now leaving. Presumably they were able to shield the passengers from our view, but it appears that they were able to get off the plane and are now making their way towards the hospital at this time. So there you see them slowly making their way out of the airport facility. Again, just about 30 minutes before the first flights are scheduled to depart the airport. And right now, all flights in and out of the Omaha airport are still on time at this hour. Okay, we are working to get some new information from the Associated Press here, so we're going to get that here for you shortly. There you see that the motorcade has left the airport. They will be making their way to UNMC Nebraska Medicine here in downtown Omaha. We do have a camera standing by there. We don't really have much to show you there at this time, but again, they will be arriving there shortly. Here is a live picture here from the Blackstone near the hospital here in downtown Omaha. And we will continue to stand by for that new information as soon as it comes in. Okay, just a quick update that we're getting this morning from the Associated Press. We're now getting word that, and this may explain part of the delay, we're now getting word that 2 Americans have now tested positive or showed symptoms of Hantavirus. A French woman also testing positive after leaving the ship bound for France. There were 5 French passengers that were returned home. 1 has tested positive for Hantavirus. 1 of the 17 American passengers tested positive, as we had been reporting, but they did not show any symptoms. Another is reportedly has mild symptoms. The World Health Organization is recommending close monitoring of the passengers, and many countries have quarantined. Now, here in the United States, those that are showing those signs will be quarantining, but they will be allowed to quarantine from home. Again, we're working to get additional information from our partners at the Associated Press, CNN, NBC News, but the latest still, at least 1 American and 1 French individual has tested positive since departing the boat. Others have shown symptoms, and so protocols are still being put in place around the world where these individuals have been transported. But that is the last update we've received on the situation both here and around the world since passengers were taken off of that vessel last night. You're looking at a live picture from our location here in downtown Omaha at the Blackstone Plaza near the Nebraska Medical Facility at UNMC. We are continuing to work to get additional information as to the situation on the ground, and as that motorcade will be making its way to the hospital here over the next several minutes. Again, the motorcade now on its way to UNMC Nebraska Medicine with the 17 Americans that were on board that plane.
Position on the left side of your That's perfect.
Our crews on the scene are filing their reports now. Let's go ahead and listen in to the latest from our crews on the scene.
One of those passengers, though, has mild symptoms. Another tested positive for the Andes virus, and that's a strain that's linked to the Hantavirus. The rest of the passengers on the plane, they don't have symptoms as of now. We also have some additional video from when the patients began getting off the plane just a short time ago. UNMC officials say that while this whole process may seem alarming, the virus is not nearly as contagious as others that they've handled here in the past, so they say it is not a cause for alarm.
Hantavirus is a bit different in that it is not known to be transmitted person to person typically. Now, there is one single strain of hantavirus, and that's what this has been confirmed to be, that can be transmitted person to person, but typically that transmission requires very close contact with an infected individual.
Now, that one passenger who does have those mild symptoms, they will head actually to Washington, D.C. here, but the rest of the passengers on the flight, 16 people, as we just said, right now, they are on their way, traveling at this moment to UNMC Nebraska Medicine campus, where their journey here in Omaha is just beginning. For now, reporting live, Maria Cade, First Alert 6. Back to you.
Maria, thank you very much for that report. Now the very latest on what comes now next for these passengers and the reason they even came to Nebraska at all.
After landing in Omaha early this morning, all 17 of them now heading to UNMC, where a specialized team is ready to evaluate and monitor them. First Alert 6's Brenna Kiefner is live there with what happens next. Brenna?
Yes, Cerise and Aaron, good morning. The patients will be coming to this facility right behind me right here, and UNMC says that they are fully equipped to handle them. I'm going to step out of the way just to show you guys exactly a little bit of what we are seeing right now. Obviously, there's not a ton of activity right now because those patients haven't gotten here yet, but they will be inside the National Quarantine Unit. It's the only federally funded facility of its kind in the country. Now, the room includes 20 private rooms with negative air pressure. That's designed to safely contain possible infectious diseases, but the health leaders stress that these passengers are not under quarantine, actually. Now, according to the CDC, they'll undergo some monitoring and medical assessments here before likely returning home to self-monitor for 42 days. Now, one passenger did test positive for hantavirus, but is not showing symptoms. They will be treated separately in the Nebraska Biocontainment Unit. Now, UNMC's interim chancellor, Dr. Deli Davies, says each case involves a different level of exposure, but says their team trains for situations just like this.
We have a team that's interdisciplinary, that meets quarterly, that drills together. I'm part of that team. There's a lot of trust developed. There's a lot of an opportunity to test out potential scenarios of things that can occur.
And in just a few hours, around 9 a.m., we were told that local, federal, state leaders, including Governor Jim Pillen, will be coming to UNMC for a press conference, just giving an update about those patients and their conditions. We will be streaming that on air and online as well. Live at UNMC, Brenna Kiefner, First Alert 6.
All right, Brenna, thank you. We'll be checking back with you soon. Meanwhile, good morning, everybody. It is so good to have you with us on this Monday morning. I'm Cerise Cole.
And I'm Aaron Hartley. A first alert to a warm start to the work week. The senior chief meteorologist, Rusty Lord, here now to fill us in.
Yeah, you heard.
Okay, we're going to go ahead and come back here to our live coverage. We are awaiting a updated image from our crews on the scene on the situation there, where we are working to get more information. Let's go ahead and go back out live now to Eppley Airfield. There you see the plane still on the tarmac at this time. We were getting some indications they may be next headed to Washington, but right now most of the passengers, if not all, have been taken off of the plane and will be making their way to the UNMC Nebraska Medicine shortly. But we continue to monitor the situation at the airport right now, as just a limited number of crews there do remain on the scene at this hour, and we will continue to monitor the situation there as that motorcade is now making its way to the hospital as we speak, and should arrive in the next few minutes. We will continue to monitor our team there as well at the hospital. Okay, just getting a little bit of an update here. We are learning that, as you heard from our crews a short time ago, that one of the passengers did not get off the plane. They will be going to Washington, D.C. We don't know if it is the individual that tested positive or if it's the individual that is symptomatic that has not yet at least tested positive. But one of those individuals, as it has been decided, will go to Washington, D.C. Okay, so quick update. The individual that has not tested positive but is exhibiting symptoms of Hantavirus did not get off the plane. They are going to Washington, D.C. The individual that has tested positive, along with the 15 others that have not tested positive and are not showing symptoms, they all did get off the plane and will remain here in Omaha, at least in the short term. The individual that has tested positive will go to the Biocontainment Unit. The others, not sure as to what level they will go to the quarantine unit, but right now the plan is to process them, and those that are deemed low risk will be allowed to go home to self-quarantine for approximately 42 days. So that is the latest from our crew on the ground. Let's go ahead and take you out live now to our other crew. This is at UNMC, Nebraska Medicine. There you see still a very early hour, but the patients and cruise members will be arriving there again. The individual that has tested positive, as well as 15 others, are being taken to UNMC at Nebraska Medicine as we speak. Another that was exhibiting symptoms of Hantavirus did not get off the plane. They will be taken to a facility in Washington, D.C. There had been some discussion about a landing in Washington, D.C. Late last night, some confusion whether or not they would be landing there before Omaha. Now it appears that not sure if this was the plan all along, but the developments in the air, at least, they decided to continue the plan to Omaha, and are now that plane will soon be departing for Washington, D.C. Back out live now to the airport where the plane remains on the tarmac, but we're seeing some of the stair trucks and other equipment now leaving the area. Presumably the plane will be prepped and prepared to depart for Washington, D.C. Not sure how long that will take, but the first departure flights scheduled at the Omaha airport are set to take off here in the next few minutes. So it will have to be shuffled in with that time, because at last report, all flights in and out of the Omaha airport are on time, with flights beginning to leave here in just a few minutes. Right now, no delays associated with the health emergency being dealt with at the hospital right now. Back out live now to Nebraska Medical at UNMC. There you see the campus relatively quiet at this early hour, still just 5:10 this morning, and we are standing by for the motorcade to arrive there. We don't expect any major activity at the hospital once they arrive, but we do expect that we will get an update this morning around 9 o'clock. We do expect health officials as well as leaders at the hospital, and Governor Pillen will be on hand for this morning's news conference. Again, that's scheduled at 9 o'clock in just under 4 hours from now at the health facility here in downtown Omaha. We continue to be monitoring the situation both at the hospital and at the airport. We do have crews in both positions right now trying to get the very latest on the situation at both locations. Again, the latest from officials is the individual that has tested positive for hantavirus has not exhibited any symptoms. They, along with 15 others that are neither positive nor symptomatic, are being transported to Nebraska Medical at UNMC as we speak. Other than that, one other passenger that was exhibiting symptoms but had not yet tested positive, they are going to be transported to the to Washington, D.C. for further observation and or treatment. And there you see the what appears to be the first vehicles arriving at the hospital. Not sure if that is the actual vehicle from the airport, though, because it appears to be all by itself, actually. So we're going to stand by here for a moment, but they are pulling inside. There you see one passenger van moving in, and it looks like there's the other one behind it. So these appear to be the vehicles from the airport that picked up what now appears to be 16 individuals that are staying here in Omaha. The individual that was exhibiting symptoms did not get off the plane. They will be going to Washington, D.C. 15, along with another that has tested positive for hantavirus but was not exhibiting symptoms. They have now all arrived at Nebraska Medical at UNMC. So there you see the passenger vehicles going into a interior garage away from public view. As there you see the garage door closing. The patients have now arrived at UNMC at Nebraska Medical, where they will be taken to those specialized facilities for observation and evaluation. Our next update from the hospital is expected to come at 9 o'clock this morning. That is when a news conference is scheduled with health officials, hospital officials, and Governor Pillen here in Omaha. We will bring that to you live at 9 o'clock this morning when that happens. So the 16 of the 17 on board the plane have now arrived at the hospital. The 17th, which was exhibiting symptoms, is still on the plane at the airport, and that plane will soon depart for Washington, D.C., where they will go to another facility. But 15 Americans that were not exhibiting symptoms, 16 rather, I should say, are now at Nebraska Medical at UNMC. One of those 16 has tested positive for the Hantavirus, but was not exhibiting symptoms. So that is the latest that we have as those passenger vans that we saw depart the airport have now arrived at the hospital here in Omaha. Let's leave the hospital for a moment. This is a live look. You can kind of make out the tail still of the plane there at Eppley Airfield, where they will be taking off, presumably in the near future, for Washington, D.C. This was the scene just a short time ago as the vans, as we noted, were leaving the airfield with the 16 on board who are going to be staying here at least for a while. Again, one individual who was experiencing symptoms did not leave the plane and is now going to be sent to Washington, D.C. But this motorcade of ambulances and passenger vans transported the rest of the individuals to Nebraska Medical at UNMC. And they will be evaluated and checked out for, and hopefully we'll get an update here in just about 3.5 hours or so from that news conference scheduled for 9 o'clock later this morning. Again, this was the view just a few minutes ago as they were departing the airport. They have now arrived at the hospital, but right now, as we take a live look at the airport, there you see the plane remains there, but we'll soon be heading to Washington, D.C. with one of the passengers who is now symptomatic, and they have decided to take them to a facility in Washington, D.C. rather than here. As for the rest, they are now at the medical facility here in Omaha. One of the individuals out of the 16 has tested positive. One exhibiting symptoms remains on the plane, and the 15 others are also here at the hospital, and we expect to get an update here at 9 o'clock. So again, as just said, we do expect to get a live update at 9 o'clock this morning from officials at the hospital, as well as other leaders, and Governor Pillen will be providing us a full update coming up at 9 o'clock. And as always, we will bring that to you live here from the Alert Center, on air and online. We will have that on our live streaming channel. We will have that on our social media channels, on YouTube, Facebook, and much more. So that does it for our early morning coverage of this breaking news event here in Omaha. Of course, the First Alert 6 newsroom is tracking every angle of this story all day long. When we learn information, we will bring it to you on air and online at firstalert6.com. And always be sure to make sure you download our news app for alerts. When we get new information, we will pass it along to you on there. In the meantime, that does it for us. I want to thank everyone for joining us at this early hour for this breaking news update from the Alert Center. I'm Nick Weig, First Alert 6 in Omaha.